I wish I could say that there's a sort of a miracle treatment or a miracle cure, but there really isn't. All right, this is week 2, recording from the ICU. You know, last week I was in clinic, this week I'm in the ICU. Very, very different situation here, and a very heavy COVID burden. More than half the patients are intubated, 30-year-olds, 40-year-olds, 50-year-olds, all affected. Wish there was a magical cure, but there isn't. Week 2, I was placed in the ICU. They needed a significant amount of help. The morale, the energy, everything very, very different. Working in the ICU, I was sort of in the thick of it all, and I have to say that the COVID burden is pretty significant. More than half the patients in the ICU are suffering from COVID. A good amount are intubated. Individuals that have been reported to be sort of vulnerable populations. That is very true. Those individuals who are older, have diabetes, have high blood pressure, are obese, have pre-existing lung conditions such as COPD or uncontrolled asthma. Those individuals are definitely at risk. The one thing I can say, however, is that the virus is non-discriminatory. In fact, young people are definitely getting infected. We intubated a couple days ago a 32-year-old. Certainly young people are also affected. There is a sort of palpable anxiety in the atmosphere. PPE is running low. It's not out yet, but it's certainly running low. People are definitely a little bit more anxious, a little bit more scared. People are smiling, but it doesn't really seem as if they're smiling from within. It's more so they're smiling for the without to kind of give each other a little bit of a boost. I wish I could say that there's a sort of a miracle treatment or a miracle cure, but there really isn't. Product. Tell you, man, Mr. Chop Chop, S-Clips, my boy, in the nursing office. Freshest spot in Chicago.